Epidural procedure? Okay, so everybody's been asking, how the heck do you do an epidural? So there's two different types or reasons why we do an epidural. One can be for labor and delivery, right? And then secondarily, we can do a lumbar steroid, an epidural lumbar steroid injection. So again, a lot of times those are done in pain centers outside of the hospital because they're usually, you can get up to 3 of them and they're made for pain. But the epidural process is the exact same. The only difference is they usually use imaging to guide them to make sure that they're in the right spot versus pregnant women. We can't just be like smashing a bunch of different types of x-rays and things like that at a pregnant woman. So instead we do the technique blind. No, I'm not blind. What I'm meaning to say is once the area is actually sterilized and clean, we will fill this either with air or saline, and then we move this until we get what's called a loss of resistance. And a loss of resistance just means that we are inside of that space because the lack thereof of the pressure gradient, okay? And secondarily, in the epidural space, you should be able to easily thread this, okay? And notice it should be going up, and then this is what stays in the back. This goes away, and we tape it to make sure that everybody knows that this is an epidural. Even though we can push medication through there, we want to make sure that nobody pushes anything except for the medications that we choose. So that's really the epidural procedure. And the good news is it doesn't really hurt that bad for you. The worst part is a little bit of local anesthetic numbing area, and that's just basically like a little bee sting. So I personally chose to have it for my babies. Why? Because man, oh man, you don't get an award and or a trophy for having a baby naturally versus pain-free. So if you are delivering, grab a NoMo band. They are the first birthing pregnancy wristbands that were ever created. They're really cool. They actually stop you from vomiting, all by smell and by acupressure. So try them out and tell me how you like them.